Focused shockwave therapy. You can see this is the focused shockwave therapy, not the radial one. I have switched it on from the back side. You can see the quality of the product. This is quite heavy duty product, and this is the applicator. And this is not the radial type. This is focused type. In the radial type, you have the energy which is in the form of like circular radial motion, and once the energy reaches to the target, it get dissipate, and a lot of energy got lost. So, but in the focus one, you are having the focus waves which are focusing to a target with some depth. So this is how powerful that focus shock wave, because the result you are getting from focus shock wave in one sitting, that result you will get from the radial in the 3 or 4 or 5 sitting. So that is how advanced and latest and result oriented that device is as a focus technology. You can read about the technology on internet and all and YouTube, so you will also get to know. So I just briefly explained that every part of the energy is transferred to the tissue in the focus shock wave, almost every without any loss. But in the radial, it goes in the form of circular motion. So like focus, radial goes like this, and this, while the focus goes straight to the pain area or the inflamed area. So now I will show you the demo of the device. This was the brief description how radial and focus are different from each other. Now I will show you the device and demo by operating this. So I just switch it on from the back side. You just see, I just switch it on, and we are the importer of this device. So you can see our logo over here. We are the importer, Biotronix Solution Forever brand name, and Biotronix here International LLP. This is our company. So now I am going to enter into the interface, and you can see this is the applicator. It's quite lengthy, and this is the quality of the product. You can see there is a scanning, there is a code written on the applicator. That code has to be entered in the same. This is the physiotherapy applicator. We also have the option for the ED applicator for the erectile dysfunction. There is a different applicator, and I will that applicator is having the different ID, and you have to enter that ID in the same. And this is the physiotherapy applicator, you can see, and this is the ED applicator. This is the back side of the same, which has to be inserted from the back, and this is the ED applicator. So you can see there is a different code written over here. So if I put the ED applicator code over here, the ED applicator will be activated. If I put the physiotherapy code, the same will be activated. I will show you how to do the same. So this is the this is asking for the handle code. The handle code is written over there: 252325232599. I just entered the same. I have gone to the interface. So you can see over here, this is the profile IDs. I have already created guest, random, and user one. If you want to create the same with some name or other, you can also create the same, like adding the same. I just put the name over here, anything, and I just need to put the age over here, male or female. In case of ED applicator I am using, I just can use the male option only. Female option is not valid over there. And in case of physiotherapy, both options. So like I am going over here, I have already created the various profile, and you can see this is the guest profile. Age, sex not mentioned over here. I didn't mention the same because that is the default profile. And random profile, I have mentioned the age and the gender. Plus I have used the same in the guest mode for around some time, and the energy provided over there is also mentioned, and the time I have used it 11 minutes 30 seconds, like this. So every data will be coming over here. You can also delete that whenever you need this. So now I am entering into the guest mode. and now entering with the guest ID. This is the guest ID I have entered, and now you can see the various programs. This is for the neck, shoulder, back, buttock, elbow, wrist, hand, knee, leg, ankle, foot, and ED, and fat accumulation. So almost every part, every joint is over here, and these joints are also marked as R1, R2, R3, R4, R5, R6, and R7, and up to R13. So now, like suppose if I go to some of the section, like I go to the hand section. So I selected the hand section. Now you can see these are the hand parameters. But before doing the same and starting the same, I will go to the setting section, where I will go to the help section, and here there is a program named remove bubbles, because while using the focused shockwave, the water get filled up in the same. I have already filled the water bottle at the back side. I already inserted the same. In the next videos I will show how to do the same. But when I start the same, the the water get filled in the same, and you can see this is the air bubble. So I have to remove that bubble before using the applicator. That point of the applicator should be bubble free. So this is the bubble applicator. Now I will remove that bubble. You can see you have to place the bubbles to the arrow. You can see this arrow. You can see the bubble are going over there. The bubble now water is getting filled, but the bubble are going over there. So as soon as I have to shake the same, and you can see the bubble. When I put the bubble on that arrow from here to there, this arrow, you can see that at this arrow, and once the bubble will reach there, and in the bubble removal mode, the process is going on, and bubble has been removed. Now you can see there is no bubble over here. Now I can use the device, and I have removed the bubble. So make sure that you remove the bubble. Don't let any bubble inside the same before using the device. So this is the process of removing bubble. Now I will show you. I'm going in the exit mode. I'm going back, and now I am going to the again that section where all the protocols were there. I'm selecting the hand, and you can see this is the recommendation. You can see hand overuse and strain in the hands can lead to inflammation and pain in the tendons and joint, especially affecting the wrist and the finger joint. So in these conditions, the same can be used, and the recommended intensity is 3. It's already set to the 3, and the recommended frequency is 90, already set over here, and shock waves short should be 1000, already recommended, and application once every 10 days, session 3 to 5. So everything is mentioned and recommended and suggested over here. These are the recommendation. Already by default it is set over here. So if you are using some condition, want to use for some condition for the hand, you can use this recommended one, or you can use by varying the by changing the same according to the patient condition, illness, and your analysis. So here you can see these are the recommendation. When I close the same, recommendation gone. If I want to say the recommendation again, I click on this R7 button. R7 was the indication of hand, so I will again get the same. So I'm closing the same because I have seen the recommendations, and I'm just starting the same, and now I will show you the output of the device. You can see over here it is energy, total energy delivered, millijoule, and it is the total time. And this is the number of shots, total shots, and this is the program you have selected, R7 for the hand. So this information is also here, and first I will show you this, and then I will explain you further. So now when I start the same, it will take few seconds. It's showing the indication to get ready. Once the same will be over, you will get the green indication over here. This time the water is getting again filled up in the same, and now you can see you are getting the shot. So this is also the button over here, and this is the switch over here, you can see. And now I'm putting the same on my hand. You can see, make sure that there is no bubble in the same, and now you can use it. So you can see you can I'm feeling that shockwave, and it is 3 in the intensity. So the intensity you can go from up to 1 to 15. Let me stop the sim and I will tell you. You can go up to 1 to 15 as intensity. It is just 3 right now, and you can go up to 30 to 180 frequency. It is 90 right here. And intensity and frequency, if you increase the frequency intensity too much, it will adjust the frequency automatically, so that you can get the maximum and the more result oriented output of the focus shockwave. So if you increase to some extent, you may find that frequency is getting decreased. So that is the technology of the device, that it adjusts the frequency and intensity in such a way that you get the maximum result out of the same. So I will show you the same also. And preset program you can set up to from 500 to 5000 in the multiple of 500. Like if I increase it in just a minute of seconds, you will go up to 5000. So this is how 3500 I have set it, and this is the calculator. This is the counting section of the. If I start the same and the shot will be delivered, it will get counted over here. Like 29 I have already used. So you can see all the energy factors after I have used for the 29 shots. 260 millijoule has been supplied, and to 21 seconds I have used, and 29 shots I have used. So now I am starting the same, and now I am varying all the parameters, so you can see. I am varying all the parameters, now you can see. So I just started, you can see I am feeling that in my hand. Now I will increase the intensity by one, slowly. You can feel the difference. 7. You can. I am now. Wait. I am getting enough in my hand. As the recommended one was also less, and I am getting enough in my hand. And I am just getting the focus. I am not feeling the same on my surface. I am feeling the same inside my tissue area. So this is the 8. And if I go a little bit more, 9. 10, 11. I am getting quite enough, so if I will go more than that, I may get injured. So this is the 11, and like if I go to the up to 15, now I will increase the frequency. 120. In the multiple of 30, it will increase. You can feel the difference. You can feel the difference in the sound also, and I can feel the difference in my hand also. 150. So this is 150, and I am feeling a very focused shockwave on my hand area which I am using. 180. As soon as I get to the 180, you can see I have gone from 11 to 9. So intensity adjusted accordingly according to the frequency. So if I increase the intensity, 9, 10, you can see it is decrease up to frequency, decrease up to 150. So that is the technology by which intensity and frequency are adjusting in such a way you are getting the maximum out of it. So you can see also you can see the shots is getting counted up, and the principle of focused shockwave. The principle of focused shockwave is that it is using two heavy duty coils, magnetic coils, with the help of water hydroelectromagnetic energy they are using, and they are providing you the focused shockwave with the same. So so you can see so now you can see parameters like frequency, intensity I have told you already, 10 to 15, 130 to 150 in the multiple of 50 or in the multiple of 30, but both will accordingly adjust when one of the parameter is up to the maximum limit or higher limit. The other parameter will accordingly adjust it by automatic. So, and this is the number of shots. You can go up to 500 to 5000, and this is getting counted up over here. So I have got 270 shots. All the parameters like 270 shots is there, energy delivered to me is there, time used is there, and everything is there. And this is the automatic mode I am using. You can see A and this mode. if this is the automatic mode where I press the switch and I'm getting the automatic shots in the same. But I can go up in for the manual mode also. In the physiotherapy also, or in the ED also, I can go a manual mode, because in the ED you have to go provide the selected shots and in the selected area, or if you want selected shot and you want the shots in the control of you, then you can go for the manual mode. Like I will show you how. This is the manual mode. You can see I have selected manual mode. Now if I click on the same, I'm putting the same on my handle, click, I'm getting the shot, click, getting the shot, click, getting the shot, click, getting it. Now I'm not getting the continuous shot. It is a manual. Whenever I select, I get it. I go to the point, that area where I want to focus, I force same and I provide the shot. If I want to provide lesser shots and in the control way, I can use the manual one. And this is the automatic one. You select the automatic one, you press the button once, you will be continuously getting the shot and getting calculated. So this is how the device is having both the manual and automatic shots option, as well as all the parameters can be varied. Also intensity and frequency, they will understand each other and vary accordingly. Once I increase the intensity too much, the frequency will get decreased up. Once I increase the frequency too much, the intensity will decrease up a bit to get you the maximum output. Now, as I have told everything of the same, this is the depth adjustment. You can see I can go up to 1, 2, 3, 4, 5. The more I go for the depth, like if I go for the 5 levels, the water will get filled up in the same, and the more is the depth, the parameter selected over, the lesser the output I will get. So like if I select the 5 one, so the output of the same will get decreased. So I need to deliver more energy to that area, and if I decrease the depth to the 1 or 2, so the output will become more in the same. Everything is mentioned in the manual also, so you can refer the same also, but I am briefly explaining the same. The more the output value, depth value you will select, the more the depth value you will select, 1, 2, 3, 4, 5, the lesser the output will become. The lesser the value, the output will be maximum. Stop the same. Now I have selected the C, as I have selected the 5 as the same is totally water filled, and you can see I am getting the depth adjustment. So this is the depth principle, and now I will stop the same. So I have explained you all the parameters and everything. If I go back, I need to long press the same to stop the treatment in between, and I will go back, and you can see I can go to the other section now. The recommendation over here is different from the one. 6 is the intensity because the area is better, and the fatty tissue is there, so you have to the suggested parameter according to that. So if I go back here, these are the parameters, and now you can see in the help section you have the drainage option also. If you want to, after using the same, you can drain the water out of that row using the drain feature. So you have to select the same and you can drain. Now right now I want drain. I'll be making a different video for the same, and this is the, I was just telling you how to drain the water out of it. So, and this is the applicator stand. You can see this is the magnetic one. You can place it anywhere and it will get stick. So you can see how hard it gets stick, and you can place it anywhere and you can place your handle over like this. So this is the demo of the device, and the device is connected from, already connected the same via Wi-Fi. So you can connect the same over Wi-Fi, and if there is any update in the software, the same can be downloaded and can be updated in the same. So these are the various parameters and everything in the video of the focused shockwave, and I have already told how focused shockwave is much more effective than the radial one available in the market. We are also importing the radial one. We are also importing the focused one. But focused one is the best technology since yet. But radial one is also people use and doctors are using the same. But the result you are getting from the focused one is incredible as compared to radial one. And this is how stylish and design look of the device. You can see the light over here and everything. So thank you for watching the video, and if you want any more information or catalogs or price list or everything related to device, you can comment in the comment section, or we have already linked everything in the description also, or you can reach us via WhatsApp or call. Our sales team will get back to you and explain you. Thank you for watching. Keep on sharing the channel and videos, and do subscribe the channel. Thank you for watching.